good day and welcome again to my channel. My name is Asa Big Joe. I film content based on family lifestyle, living in the UK, tips and tricks on how to migrate to the UK, and all those juicy stuff. So guys, I've been getting messages from my subscribers from yesterday night till this morning. When I came online this morning, I've been seeing tons of messages and I just wanted to clear you guys on this once and for all. So I'm going to be reading directly from the UKVI website, and I'm going to be explaining what they mean by this. So now, yes, it is true that Nigeria is now on the red list. Like, they are listed among the red list countries where you cannot health and care workers cannot be recruited from Nigeria. But that is not the whole thing. You know, in this channel, I'm going to be giving you the real story, the real gist, what they mean by what they wrote on their website, because now I've seen that many people are now carrying and spreading news that are not true. So now let me just go right into the video. This video is not going to be long at all. So directly UKVI website, it is said that the WHO workforce supports safeguarding list for the 2023. It comprises of 55 countries, of which Nigeria is among. They said these countries faces the most pressing health workforce challenges relating to the universal health coverage. In these particular countries, they have a density of doctors, nurses, midwives below the global minimum, which is 49 per 1,000 population. So, and in Nigeria now, we don't have 49 workers, healthcare workers per 10,000 population. And number two, a universal health coverage service coverage index below. They have a certain threshold that a country is supposed to have before other countries can come and recruit their healthcare workers, and Nigeria doesn't fall among this minimum. And I don't even want to talk much on this, because I know in Nigeria we have healthcare workers. I know that if the Nigerian government is going to harness the healthcare workers we have, I know there are so many doctors in Nigeria currently looking for a job, and they are saying we don't have healthcare workers. But that's not what I'm going to talk about now. But they have already told they have already told the WHO that in Nigeria we don't have enough doctors and nurses, and that is why they are getting funding from the WHO. And even though we don't know where all this funding is going to, because the doctors and nurses in Nigeria are still the least paid in the whole world. Like, they're still one of the least paid in the whole world, even with the funding they currently get from WHO. So it is already said that from the WHO that other countries should not recruit healthcare workers from Nigeria. So that's one of it. And then also, I'm going to be putting the link in my description box in case you want to read further. So also the code of practice in the UK, it applies to these following people: the healthcare professionals, the care workers, the dentists, the doctors, the healthcare scientists, the medical staff, the midwife, the nursing staff, the residential and domiciliary care workers, the social care workers, and the support staff. These are the people that they won't be actively recruiting from Nigeria. When I mean actively recruiting from Nigeria, it simply means that, you know how the educational bodies come to Nigeria and do education fair and, you know, actively recruit people, students from Nigeria if you want to go and study in the UK. They are not going to be doing it for Nigeria, because they recently sent some people to Nigeria to go and sign a treaty so that Nigeria can they can come to an agreement so that healthcare workers, they can come to Nigeria and recruit healthcare workers directly from Nigeria. But our government said no, that they don't want them to come to Nigeria to recruit healthcare workers. Then again, if you want to work in the UK as a healthcare worker, be it a doctor, a nurse, a care worker, a domiciliary care worker, a dentist, a lab scientist, and all the stuff, they have companies that are recruiting. So you just go directly to the company and apply directly to the company. Then if the company wants you, they will send you a COS and recruit you from Nigeria. But they are not coming to Nigeria to pick you. You are the one that will spend you're going to do all the whole thing by yourself. All the whole application process, everything is going to be on you. Your visa, everything is going to be on you. So that's what it means. You are still going to be able to apply to companies in the UK here and get, if they want you, they'll send you COS and they'll get you to come and work for them. But there is no company that can come from the UK now to Nigeria to recruit people directly from Nigeria and bring them over to the UK. No, you're going to do this of your own accord. You're going to do this by yourself, and anything that is going to come out from this particular stand that you have chosen, the Nigerian government is not going to back you up. If the company scams you, the Nigerian government is not going to back you up. They're not going to be held liable for anything that comes out of your business with any other company that is in the UK that you want to migrate to or you want to go and work for. That's just what this simply means. I'm going to be posting the whole link and how you can read it. Let me read it directly from how they wrote it here. It says, if a government-to-government agreement is put in place between the UK and a partner country, it will restrict employees, contracting bodies, recruitment organizations, agencies, and collaboration to the terms of agreement. The country will be added to the amber list, and recruitment can apply only in terms of agreement. The WHO Workforce Support Safeguarding List is updated by WHO every 3 years. So this means that this has always been in place. As at last 3 years, it was like this. If you're a doctor or a nurse and you are working in the UK presently, you know that this is true because you applied directly to the company accepted you and recruited you, and you came to the UK to work. The company did not come to Nigeria to come and pick you from Nigeria to come and work in the UK. And it's actually okay that this is done in like it is an online stuff, so that you can apply directly to this company online. It's not like you can come over to the UK here and apply. No, you can apply online. So it is saying that the UK, the WHO list is updated every 3 years, and this is just the 3rd year that just finished. So the UK government came and asked Nigeria, okay, this 3 years has elapsed, are you still willing to allow us to recruit workers from Nigeria? They said no. So we are still on the red list. We have been in the red list ever since. It's just that it's now updated. We are still in the red list. So they said changes to the red list country list may be made on an ad hoc basis as the government-to-government agreements are signed. All agreements will take WHO guidance on the development of bilateral agreements into this account. It is recommended that employees, recruitment organizations, agencies, collaboration and contracting bodies check the red list and amber list country update before any recruitment drive. Green graded countries which have signed a government-to-government agreement with the UK for international health and social care workforce recruitment are listed separately in the Annex B. So for the countries that are the red list that are actively not, the recruitment are not actively permitted are Afghanistan, Angola, Bangladesh, Benin, Burkina Faso, Burundi, Cameroon, Central African Republic, Chad, Comoros, Congo Republic, Democratic Republic of Congo, Cote d'Ivoire, Djibouti, Equatorial Guinea, Eritrea, Ethiopia, Ghana, Gabon, Gambia, Guinea-Bissau, Haiti, Cameroon, Democratic Republic of the Laos, Lesotho, Liberia, Madagascar, Malawi, Nigeria, Pakistan, Senegal, Sierra Leone, Sudan, Tanzania, Togo, Uganda, Yemen, Zambia, Zimbabwe. But all these countries, most of their workers are here working. So if you still want to come to the UK and work as a healthcare worker, you can still work. This news doesn't mean that you can't come to the UK and work as people are saying it. You can still work, but you have to apply directly to this company, and the company have to recruit you and you already know that this is your own home country is not liable for any damages that is going to come as a result of another country recruiting you to come to the UK. Able to convince you and not to confuse you that if you still want to come to the UK, if you still want to apply directly from Nigeria to come and work in the UK as a healthcare assistant, you can still do it, but the Nigerian government doesn't have any backup. If anything comes out as a result of a scam or the company not keeping to their own terms and condition, they are not going to come out for it. So thank you guys for watching this video to the end. I hope you've subscribed, liked, give this video a very big thumbs up, share it to your family and friends that still need to get this information, because I know some people are still confused about it. And then I have other videos you can still watch in my channel. Feel free to binge watch on my videos. Until next time, guys, I know I'm owing you guys video. And I'm owing you guys an update on the place I'm currently working now. I'm going to be giving you guys that update. See you guys later. Bye.